He walked into my office, skeptical, tired, and carrying 20 years of daily headaches. He had tried every treatment out there. Nothing worked. But after a few months of targeted therapy and a special tool we introduced, everything changed. I'm Dr. Ben Benjamin, and in this video, I'm going to tell you exactly what we did, why it worked, and how you can use these strategies to help your clients too. Let's begin. A friend of mine recommended a very skeptical professor from MIT to come see me. He had suffered from headaches for over 20 years. She practically coerced him into my office. He was challenging, convinced that nothing had ever worked and nothing ever would. At the time, I was working at a medical office and had the doctor check that there was no serious disease process that I would not be aware of that might be causing his headaches. He always had a headache. It was either a low-level occipital, forehead, temporal pain. He described it as feeling as if he was in a constant fog. Then every 2 months or so, he had such a severe headache that he had to leave work and go to bed for a few days. This particular pain was on one side of his head, and it felt like there was a stabbing sensation right behind his right eye. Extreme light and sound sensitivity during these painful episodes. He drank 8 to 10 cups of coffee a day, loaded with sugar all the time, to kind of give him some relief, but it didn't work. When he rotated or flexed his neck, it caused pain in his neck and head. He had been to numerous physicians and had tried medication, massage, physical therapy, and chiropractic treatment, but nothing had helped him. He was rightly skeptical of anything that I could do at our clinic. His suboccipital and occipitalis muscles were very tender to the touch, as were his forehead and temporal muscles. The orbicularis oculi muscles around the eye were incredibly tender and painful with very little pressure. Passive rotation to the right and left were painful in his neck, as well as passive flexion and extension of the neck. All of the resisted motions that I tested on him of his neck were strong and they were not painful. This eliminated all of the muscles of his neck. They were not the cause. When I palpated his upper cervical ligaments, both at the posterior and lateral sides, he nearly jumped off the table. He had severe ligament damage to most of his upper cervical ligaments. My conclusion was that he had 3 types of overlapping head pain: muscular tension headaches that were constant, periodic right-sided migraine headaches, and cervical ligament injuries that constantly referred pain to his head. It's no wonder that he had trouble getting help. I knew he was skeptical, so I told him all this. And I said, give us 2 months, twice a week, and let's see what happens. I assigned an excellent therapist that I had trained who worked in the clinic under me, and she began to see him twice a week. I saw him for a follow-up a month later, and he was not skeptical anymore. He wasn't better, but he wasn't skeptical. The headaches weren't gone, but things were different. The daily headaches were not daily anymore. He would have a headache for a few hours, do the facial exercises he was taught, and use the neck relaxer device on his occipital region. This is a device that we give people who have headaches to reduce neck and head tension by themselves. He successfully used the neck relaxer device to get rid of his daily headaches. He wasn't done, but he believed being pain-free was possible now. It took a few more months of treatment, but when the scar tissue was gone in his neck ligaments, there was no more referred pain to his head. He did not get migraine headaches again because the triggering mechanisms were gone. The constant referral pain from the ligaments, I believe, triggered his migraines. His body couldn't take it anymore. This was one of the most satisfying cases, and that's why I never forgot it. Stories like this remind us of the power of precise assessment and targeted treatment. If you want to grow your expertise, subscribe to this channel for weekly insights and tools to enhance your practice. And if you're ready to dive deeper, check out my free mini course on treating chronic pain linked below. It's packed with valuable resources and a live demo to guide your learning. I'm Dr. Ben Benjamin. Thanks for joining me, and I'll see you in the next video.